As I move around Utah and talk to Utahns, I hear from them that their number one concern is the debt and the deficits each year that add to the debt. And they're absolutely right. That is the number one challenge we face here in Washington, indeed face as a country. But the thing that concerns me is that too many people don't understand where this is coming from. Yes, we get those items on television that look so outrageous and they're so much fun to talk about, but nobody has really addressed the area where the real spending is going on. I'm talking about entitlement spending, and it constitutes 2/3 of the federal budget, and if we don't get it under control, in 10 years, just leaving things going as they are, it will be 3/4 of the federal budget. Think about that for just a minute. 3/4 of the federal budget, and we're not addressing it. What do we mean when we say entitlement spending, a Washington speak word? Well, let's be blunt, we're talking about the most attractive and popular programs in America. We're talking about Social Security, Medicare, and Medicaid. Now, I don't want to abolish these programs because many Americans depend on them, but I want to stop their growth. Just say they're big enough now, let's cap them where they are, and as the economy grows, they will become less and less of a factor in the overall debt picture. That's why I've introduced a bill to do that. I've had these bills before and I haven't been able to get much support because nobody wants to address the most popular programs in America. I think now they're beginning to recognize that we have to do that. We have to do it for our children and our grandchildren. So the bottom line, I'm optimistic that out of the crisis we're facing is finally coming the political pressure that will allow us to adopt the kind of legislation that will truly address it. And that's why I've introduced my bill.